Hi. So the book that I read for this book report is called Complications. Here it is. Complications: A Surgeon's Notes on an Imperfect Science. It's a collection of medical essays, which is a really cool format, I think, and it's by a surgeon named Atul Gawande. I really loved this book. I found the essays very engaging, and it was great to get a look at the doctor's perspective on medicine. Now, structurally, the book was divided into three parts. There was fallibility, mystery, and uncertainty. Those were the titles. Each part had 4 or 5 essays. There were 14 in total, covering a broad range of topics. I'm not going to talk about all of them because that would be a lot, and I don't have enough time for that, but instead I want to highlight a few of my favorites. So, the first story, Education of a Knife, was especially interesting to me because it talked about the learning process, how new surgeons feel about starting procedures and learning the ropes. Like in any job, there isn't any way to learn except by doing, but one of the main differences, of course, is that surgeons do their practicing on people. Dr. Gawande commented on the different reactions he got when he told the patient that he would be helping them or assisting with their surgery. Normally people were fine with the idea, but, every so often there would be one patient that was horrified at the idea of a resident doing their surgery. It was very interesting to read about his thoughts during some of the first procedures, especially when he was terrified and didn't know what to do. He described seeing a patient with a screw embedded in her foot, and he wasn't sure what he should do, and this reminded me of a time when I needed stitches, and it made me curious as to whether the doctor stitching me up was just starting out and very nervous. Being nervous obviously isn't good in any profession, but especially with doctors. When a mistake in another person's job might cost them money or break something, a doctor's mistake could kill someone. But at the same time, I think it's important for doctors to remember what they're doing and acknowledge the seriousness of it. A surgeon once told Dr. Gawande that if you're not a little afraid when you operate, you're bound to do a patient a grave disservice. I'm quoting that directly from page 61 because I think it's just such an interesting quote, and it's interesting how surgeons have to have the right amount of nervousness, somewhere between, not being terrified at all, but then being so scared that they can't even work. So, the essays, When Doctors Make Mistakes and When Good Doctors Go Bad, addressed the issue of malpractice, and the first in particular was one of my favorites to read. When Doctors Make Mistakes opened with a description of a time when Dr. Gawande made mistakes that almost killed his patient. It's both interesting and very worrying that even good doctors make mistakes. Dr. Gawande said that because of the possibilities of medical malpractice suits if something went wrong, patients and doctors couldn't really talk candidly about anything that was happening. I want to read a quote from this essay because I think it's very powerful. Hospital lawyers warn doctors that, although they must, of course, tell patients about injuries that occur, they are never to intimate that they were at fault, lest the confession wind up in court as damning evidence in a black and white morality tale. Page 57. This is such an interesting and alarming idea to me that doctors can't even be open with their patients. It's scary to think that doctors can't tell the whole truth for fear that, they'll get sued or something. I think it's definitely a controversy about whether doctors should try to explain everything that happened to their patients or try to distance themselves from any mistakes that happened. Dr. Gawande said that at most a doctor could say, "I'm sorry that things didn't go as well as we had hoped." And I think this reminded me of the TED Talk that we watched, actually, about the physical exam and how doctors are becoming more distant from their patients, and I think this definitely also plays a part, that doctors can't really talk to their patients as candidly because of the possibility of a lawsuit. So the essay then went on to talk about something I'd never heard of. It's called a Morbidity and Mortality Conference, or they called it M&M. If you don't know, this is a routine at almost all hospitals where the doctors talk about their mistakes with each other, and it's usually once a week. I think it's so important for doctors to have a time where they can figure out what went wrong and how to make it better. I thought it was interesting how the attending doctor always took responsibility for what happened, no matter whose fault it really was. So, Dr. Gawande once made a lot of mistakes, but his attending doctor took responsibility for it at this conference. I hadn't really thought before about how doctors handle their mistakes, and it seems very logical to me that they have this sort of an opportunity, but I had never thought about it before, so that was interesting to read. The other essay that I wanted to bring up, When Good Doctors Go Bad, talked about a doctor who used to be a perfectly normal, good guy, but who began making a lot of mistakes. It was really chilling to read about. I think that it's a very controversial issue, especially about what the colleagues should do. Should they report him to a higher authority immediately? Should they talk to him? I'm sure it's such a delicate and difficult situation because you don't want to offend someone you've been working with for a long time who is, you think usually a good doctor, and then also, as Dr. Gawande says, it's easier to do nothing. So I thought that was very controversial and very interesting. Now, I learned so many things about the human body. One story, I think it's called Crimson Tide, talked about blushing. I had no idea that this was a problem that affected people so much that they wanted to have surgery to stop it. I was surprised to hear that there was a surgery to stop something like this, too. It always amazes me to hear about the wide range of things doctors can do, things that I'd never even thought of before. It was also interesting to hear the side effects of this particular surgery. Horner's syndrome is the most serious, where some things happen to the eye. But then another side effect was sweating. Patients usually apparently have their upper body stop sweating, and then their lower body sweats more. I know that, the whole body is connected, but it was cool for me to see such an obvious example, especially since, I don't know, it was just something that I hadn't really expected to hear, but it was very interesting. Now, there was also a case in the story called the Case of the Red Leg, which talked about a girl named Eleanor with flesh-eating bacteria. That terrified me and really showed me how doctors sometimes don't even know what to do for sure. They were wondering whether to amputate her leg, and then they decided to put her in an oxygen chamber. I don't know, it was very scary to see how, doctors, the people that you think are so in control, might not even know what to do. So, another story talked about pain, and it was called The Pain Perplex, which was interesting because, it said how some pain, even especially chronic pain, might be psychological, which was so cool and really showed me how much we don't know about the human body. I'm taking a course in neuropsychology next semester, so maybe I'll get to see more of how the brain works and how it can create pain. The story didn't really offer a conclusive explanation for pain, but it really made me wonder how pain works, and I'm interested to read more about it. So I definitely recommend this book to pretty much everyone. Regardless of whether you want to become a doctor, it's such an interesting read, and it doesn't use too many confusing technical terms, so no prior knowledge is necessary. I like the format. Having short essays gives the reader a sampling of all these different stories and all these incredibly different experiences, which I feel like really shows what it's like to be a doctor, but it doesn't overwhelm the reader with one, long and detailed account of a specific occasion. I think Dr. Gawande is such a talented writer, and the book definitely gives a new perspective about the doctor's side of things, which is something I hadn't really seen before. It was very interesting, especially since I'm considering surgery or being a doctor as a possible career path. So again, it's called Complications, A Surgeon's Notes on an Imperfect Science, and it's by Atul Gawande. Thank you!